Fifth, a 65 years old man with syncope, dyspnea, and leg edema. Definition: syncope is defined as transient, self-limited loss of consciousness with an inability to maintain postural tone that is followed by spontaneous recovery. Dyspnea refers to the sensation of difficult or uncomfortable breathing. Leg edema: edema is a medical term for swelling body parts from injury or inflammation. Application in nursing. The patient had been in this usual health until approximately 1 month before admission. When count occurred on wake later, his leg became swollen as weeping short developed. Dyspnea and exertion without obturnia developed has was associated with weight gain of 7 kilos. The patient was seen with this his primary care psychiatrist and other hospital. Pros and cons. Pros: it is important to identify the price curve of syncope, because the prognosis for patients with syncope depends on the underlying disease. Cons: size mortality is worse among patients who have syncope caused by structural heart disease or as cardiovascular entity. It is critically important to consider cardiac cause.
Are aging and becoming less flexible as we get older. This can mean that we can see symptoms as simple as a bit of lightheadedness when rising from a chair, all the way through to actual collapse in a public place or warm environment. So we see this as we get older more commonly because we are aging, and that aging makes us more susceptible to blood pressure drop. Syncope can be caused by many things as we get older. Aging is clearly part of the process, but of course, as we get older, we also acquire other conditions which may affect our heart function, or maybe may require therapy that puts us more at risk of having collapsing episodes, such as blood pressure tablets or water tablets. These can lead to dehydration and a poorer response of our blood pressure as we move around our environment. So we can find that not only is aging the problem, but other illnesses that we also suffer contribute to an increased risk of syncope in adults.
Asylum in Ecuador. A 65 years old man presented with syncope 1 month earlier called dyspnea and leg edema had developed. Imaging study of the chest revealed lymphadenopathy and echocardiogram showed hypertrophic obstructive cardiomyopathy.
common symptom in a lot of illnesses and conditions. People think of COPD or interstitial lung disease or pulmonary hypertension, but it can also go along with conditions like heart failure and cancers. And really, there can be so much suffering that goes along with the shortness of breath. It causes anxiety and depression and dependence on others for help around the house and doing.
Conclusion. The patient has done well after cardiac surgery. He is being monitored in both two SYNCOPE clinics and the hypertrophic cardiomyopathy clinic at this hospital.
That continually pumps blood to the lungs and organs of the body. Inside the heart are 4 chambers, 2 upper chambers or atria, and 2 lower chambers or ventricles. The ventricular septum is the muscle which separates the 2 ventricles. Hypertrophic cardiomyopathy, HCM, is a genetic heart disease where there is increased thickness of the left ventricle, predominantly affecting the ventricular septum. There are 2 types of HCM, non-obstructive and obstructive. Obstructive HCM occurs when the mitral valve makes an abnormal motion and contacts the thickened septum, obstructing the flow of blood from the left ventricle out of the heart, as well as causing leakiness or regurgitation of blood back into the left atrium. This obstruction to blood flow and mitral regurgitation creates high pressures in the heart and is the main cause of limiting symptoms in patients with obstructive HCM. Symptoms may include shortness of breath with exertion, chest pain, dizziness, or exertional fatigue. Although there is no cure for HCM, there are several effective treatment options available to improve symptoms.